To a counselor who's met a deaf person for the first time, I would say, don't be afraid. Don't create barriers between you and your patient. If you don't understand the person, tell them that. Speak very clearly. Work with them. Be patient with your patient. Try to be flexible. In a counseling situation, an interpreter works both with the patient and the counselor. The counselor will have to be flexible as to where the interpreter will sit. The interpreter should have mental health training and also be certified by the Registry of Interpreters for the Deaf. If you hire an interpreter with those qualifications, it would really benefit the process a lot. Also, the interpreter should be familiar with the signing style of the deaf person or the deaf patient. Don't look at your notes. In order to build trust with your deaf patients, it's important, even if they may not look at you all the time, continue to make eye contact with them. Be compassionate. Be open. Be flexible. And if you don't understand, always ask. Always clarify. And that will build trust between you and your patient. And if you have good communication with your patient, the trust will be there. If I'm talking with a therapist and the therapist can sign, the therapist looks away from me, I would feel that there is no connection. I would feel they're not really listening to what I'm trying to say. Or maybe they don't want to help me. If they look away and they don't make eye contact, in my culture, that's seen as a way of not being interested and not wanting to continue talking about that issue. So it's really important to continue to have eye contact with the patient who's deaf. And eye contact really is about trust. When you're a therapist and you schedule an appointment with a deaf person, I strongly suggest to have the same counselor with that interpreter as well as having the same interpreter. During my meetings, while the counselor and I and the interpreter are sitting in the room, we make the next appointment. So we make sure that everyone is available. And we make 3 or 4 appointments in advance. And at that third or final appointment, then we will schedule 3 or 4 more appointments. And so we work as a team. And if you do that with your deaf patients, the deaf person will feel much more comfortable with the continuity of service when you'll have the same interpreter as well as the same therapist. And that establishes trust. And there's also confidential issues. Now, it's also maybe important for that interpreter to have a backup interpreter, and it would be an interpreter that the deaf patient is comfortable with. I have one interpreter that is my consistent interpreter, and if there's something that arises where my regular interpreter can't come, we do have one interpreter that's a backup interpreter. If both of those interpreters are not available, we do try to contact each other through email to make a new appointment and not continue that appointment without either interpreter. And it's worked out really wonderfully for me. Hearing people typically will have a hotline, the 211 to call, and that is not accessible for deaf people. So my counselor and I have set up an agreement that from Monday through Friday, there's an email during business hours that I can email her on. However, if it's on the weekend, if I'm feeling there's something that I can't wait, then I go directly to the emergency room. Fortunately, I haven't had to do that yet. I have emailed her a few times during the week, though, just to get something off my mind. And she will reply the next working day. And that's worked out pretty well so far. When I have an interpreter, I prefer the interpreter be sitting right next to the therapist, because I will watch the interpreter, and then she can watch the interpreter also, and I am able to keep my eye on both of them. And I also know that the counselor is able to hear what the interpreter says, and I know that I am establishing trust with my counselor when she's looking at me and we're making eye contact. So.
Well, really, at the heart of it, they don't provide interpreters. I can give you an example. I remember during my intake, I sat in a room, I was very nervous. They closed the door and I was like, oh gosh, I can't even get out of here if I want to. I was alone. And so I had to knock on a window and say, I am deaf. I might be able to talk here, but I can't hear you. So they wanted to do this assessment or whatever. And so I said, I think I need an interpreter. And they're like, why? You talk fine. You can understand me just fine. And I'm like, keep in mind, I'm depressed at the moment. I'm not thinking straight. I'm not thinking I need to put on my advocacy hat here. I felt like a kid, like, okay, a puppet again. Okay, if you say I don't need one. So then they started asking me questions. And if I don't understand, I was afraid to ask them to repeat themselves. So often I would brush it off. They would ask me a question. If I didn't understand it, I would brush it off. Like, never mind, or whatever. And I remember once in an assessment that happened. And I want to say maybe 1 or 2 days later after I was admitted, I still had not had an interpreter. Of course, nothing was really helping me. And as I mentioned in my story, I've been in and out of a lot of different programs and so on. Even pre-assessment. I do understand that you need to be respectful, and sometimes asking for an interpreter last minute isn't successful because it's not like they grow on trees. They don't. There's no magic involved. So typically I'm in the habit of calling now. If I know an intake's coming up, I'll say, hey, this is my name. I need an interpreter. Can you please find an interpreter? And when you do find an interpreter, call me back. I have a video phone now. Call me back, and then I'll show up for the intake. Because I don't want to waste their time. I don't want to waste my time and just sit around and not really understand. And that has worked better. But the one very worse experience, it's hard for me to talk about, but I will try and share it anyway. I went to the hospital. And they had asked for an interpreter, or I had asked for an interpreter. They were trying to use a TTY. So a TTY is something that they need to borrow out to the nurses' stations and so on, because it needs to be attached to the landline or whatever. So if I wanted to make a call, I had to wait during a break time, and I would have to go and ask the nurse, hey, can I have a TTY? Sorry, I'm busy. I'm, distributing medication. And then by the time they were available, my break time was over because it was only 15 minutes. So maybe I would get the TTY with 5 minutes to spare, but by the time the relay operator is on the line and you have to type in, hi honey, GA, which means go ahead, it's your turn to type. Yeah, like when I was calling my husband, I would have to call him, connect with him, then the operator has to type what he's saying, and it's just not efficient. And then the nurse would not allow me to have it in my room because they wanted to be able to see me if I was using it, which I hated. That's a whole nother story. But many times therapists would say, why do you have an interpreter? Why should we hire an interpreter for music therapy? I'm like, fine, I'll color then. I'm like, it's not just me that needs the interpreter. You need the interpreter too, because you can't understand me. I had to learn how to advocate for myself. And, hello, I'm in the hospital because I'm here for depression or bipolar issues or, cutting or anger issues or whatever. I am trying to heal. And I have to teach you about, accessibility. Come on, I'm worn out. I felt like I was teaching more than I was, healing or recovering. And then I felt like, they were giving me all these meds because I wasn't really taking care of myself because I was teaching them or having to educate them on the needs of a deaf person. And I don't want to be Debbie Downer about psychologists and so on, but they really don't understand. I remember one specifically at a hospital, one of those times when I was going in and out of programs. I was there was an interpreter there was a social worker there, my psychologist was there, we were all there. And the doctor looked at me and said, I'm not providing you an interpreter any longer. You must learn to become independent. And I was like, what? Oh, was I ticked. And I said to him, what do you mean by that? How am I supposed to participate in group? You want me to read lips? And you're a psychologist. You want me to read your lips? Okay, fine, I'll try. If there's no interpreter, that means the therapist needs to be deaf or they need to sign. And that doctor's response was, why? Other hearing people understand. And I'm like, that is my point, dude. They have a right to treatment, but I don't. I mean, it was more like he was getting angry and I was getting angry. We were getting angry at what we were both saying. And I was feeling like any second now I'm going to erupt. And the interpreter is trying to interpret. And finally, that doctor, he was willing to provide half-day interpreter services and half-day without. And I said, really? So you're giving me half treatment is what you're saying? I remember the quote. I can quote him during the intake. I remember seeing this big poster on the wall that says, we will respect patients' rights. And I'm like, where is that happening for me? You're not respecting my right to treatment like everybody else is. It shouldn't matter if a person is blind or deaf or the color of their skin, religious beliefs, right? And he's like, no, you're using the interpreter as a crutch to your independence. And oh, I was ticked. I went to the nurse's desk, slammed my fists on the desk, and all the other patients were looking at me. Because up till then, I was very friendly and happy-go-lucky, more or less. And the other staff members, reacted, of course. So they called security. Security came. And it just so happened I knew that guard, because as I said, I was in and out of treatment. A lot of people knew my name. 12 years in and out, you have a reputation. So I said, I'm not going to do anything. So now the interpreter was right there, and the doctor was left. And I said to the doctor, for the safety of your staff and for yourself and for the other patients, you better discharge me right now. And I was yelling. And they were like, is that a threat? And I'm like, no, take a look around the room at the other patients. Look at your other staff members and how they're looking at me. They're freaked out. If you're not going to provide an interpreter, how am I supposed to access treatment? How am I supposed to recover, buddy? You want me to stay here forever? I don't want that. I can't communicate. And so he discharged me. And I'm thinking, oh my God. You put me in this hospital and you're discharging me without really treating me. You don't care about my well-being. That's clear. So I left. I was discharged. I left. So right away, I called the Office for the Deaf and Hard of Hearing, ODHH. And they do help with advocacy in situations like these. So I called them, and they connected me to a counselor or a representative from ODHH. And the head of the hospital got involved with that psychologist. So the four of us got together, me, the ODHH rep, the psychologist, and their boss, and there was an interpreter present for that meeting. But the rep from ODHH was able to help facilitate a dialogue. The hospital, the administration from the hospital really said, yes, you were right. This doctor was wrong or guilty. And they told me that they couldn't tell me what kind of punishment he received. And I told them, I don't really care. I want this hospital, this institution to learn from this, to learn that you were in fact wrong, because if other deaf people come here for treatment and are turned down with interpreter services, that's just going to hurt them, hurt their mental health, hurt their long-term recovery. And I'm really sick. And I'm not saying it's all, but some. I just want to be clear. I'm really sick of some hearing people who feel like, deaf people, they can't do anything. I'm a person, same as you. The only difference is I can't hear you. I understand sign, you don't. So I can hear, I just happen to hear with my eyes. You just hear with your ears. It's the same thing. And without an interpreter, you couldn't understand me either. So you're working with an interpreter the same as I need to work with the interpreter. It's not like it's just for me. So sometimes it's just, I get all worked up when I think about this. So now that ODHH rep has given presentations to that hospital staff. And the staff was so thrilled with her presentation, they have asked to have it again. Well, and I should just hedge this by saying each deaf person is an individual unto themselves. I think that's hugely important for providers to know. So what's going to work for me might not work for somebody else. We are all individuals. For me specifically, I want a therapist to treat me the same as they would with someone without a hearing loss. Talk to me directly, make eye contact with me. I'm a human being too. I just happen to not hear you. So what? Who cares? I'm still a person, so look at me. If there's an interpreter, yeah, okay, they're there, but, and I'm not trying to be mean, but, the interpreter's key, or role is key, but we need to have a rapport. So that would be my number one piece of advice. I do also think that it's good. A lot of therapists or psychologists, doctors, nurses in general, behavior people, any professionals really, oftentimes they don't have training around deaf culture, and the culture piece is huge. Sometimes they ask you about your education. When doctors go to med school and so on, that's great. But if you have no training in hearing loss and how that impacts a person, you're really not going to know what to do. So yes, people who can't hear, people who are blind, yes, there are additional challenges perhaps, but we're all people and we all respond to respect. And that makes us all very equal. So I wish there would be training of some kind before these providers got out into the field, some kind of deaf culture training. I know that there's a lot of culture sensitivity training, that's kind of a buzzword right now, but hearing loss is so unique. And they think that deaf people don't have their own culture, but we do. You know, why don't they reach out to ODHH when they have an intake? You know, there are many resources that are available. I mean, I could name dozens upon dozens of resources that a lot of providers just aren't aware of. You know, ODHH is available and ready. You know, do you want me to name resources? There are so many resources, but, you know, there are people out there to help. You know, a lot of times it's just, oh my gosh, we have a deaf person, I have no idea what to do, and done. Okay, my experience at Rogers was wonderful. You know, really, the first time I arrived, the staff was very friendly. And I could tell they were a little nervous, you know, oh, there's a deaf person, what do I do? And I'm cool, you know, I'm like, just look at me, and, you know, I can read lips sometimes. Not all deaf people can, but it was very positive. I was inpatient for 2 weeks, and their assistance really helped me recover. They helped me wean off some of my medications, which was one of my goals. And without their support, I think I would be lost. And I have connections with a lot of deaf folks, and you know, if they say, hey, I'm feeling depressed or so on, I say, call Rogers. Do yourself a favor. Call them. I talk about how the staff treated me, and I want other deaf people to experience the same treatment. So I tell them to call you.